Assalamualaikum warahmatullahi wabarakatuh. Today my group will present about mental illness, and my group members consist of 3 members, which is the first one is Nur Suhaila binti Jamaluddin, and the second member which is Afifah Maisara binti Ibrahim, and the third which is Tasnim Alhana binti Mat Saleh.
So this is our e-poster, shows about mental health, and we have 4 issues of this mental illness, which is anxiety, bipolar disorder, depression, and the last one, obsession.
Assalamualaikum. My name is Nur Suhaila binti Jamaluddin. I will start the e-poster with a short introduction. Depression, bipolar disorder, anxiety. You have probably heard these terms before, but how do you know about these mental health conditions and about how they affect people? Understanding these conditions can help reduce fear and understanding of mental illness and empower everyone with the knowledge on how we care for their mental health and that of their loved ones. Read on to find out more about some of the more common conditions. So, what is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, we act, and we feel. It also helps determine how we handle stress, relate to others, and make choices. So, there are many factors that contribute to mental health problems, including number 1, biological factors, gene or brain chemistry. Second, life experience, trauma or abuse. The last one is 3, family history of mental health problems. Next, we will continue to the first content. It is anxiety. So, what is anxiety? Anxiety is a common emotion when dealing with daily stresses and problems. But when these emotions are persistent, excessive, and irritational, and affects a person's ability to function, anxiety becomes a disorder. There are different types of anxiety disorders, including phobia, panic, stress disorder, and obsessive-compulsive disorder. Now, here are the treatment and help for anxiety. Simple strategies such as relaxation techniques and regular exercises are effective in reducing anxiety and contributing to emotional well-being. Psychotherapy can help and sometimes used together with medicine to reduce and eliminate signs and symptoms of anxiety. As a result, anxiety disorders are like other forms of mental illness. They don't come from personal weakness, character flaws, or problems with upbringing, but researchers don't know exactly what causes anxiety disorders. They suspect a combination of factors play a role. So, what is it? It is chemical imbalance and environment factors. So, please be aware with this symptom.
Second is depression. What is depression? Depression is a low mood that lasts for a long time, affecting everyday life. It is often triggered by a mix of genetic, psychological, and environmental factors. Studies show that the risk of becoming depressed can be increased by life events such as poverty, death of a loved one, physical illness, or abuse. For some, the risk is also hereditary. So the symptoms is persistent sadness, loss of interest in activities, loss of appetite, feeling worthlessness, becoming easily agitated, among others. And the treatment and help is talk therapy with a trained counselor or psychotherapist. Exercise and support groups are among the options available. Antidepressants are also sometimes prescribed, but they should not be used for treating children and should not be the first line of treatment for adolescents. All treatment should involve identifying stress factors and sources of support, and individuals should maintain social network and activities. That is bipolar disorder. What is bipolar disorder? Bipolar disorder, formerly referred to as manic depressive illness, is a mood disorder with two extremes: depressed low and manic high. It varies in severity, and mild cases may appear ordinary for many years. Symptoms vary. A person may be predominantly depressed or predominantly manic. In between episodes, a person is likely to be quiet, well, and able to function. The symptoms is: when depressed, a person feels persistently sad, hopeless, and lethargic, and may feel suicidal, among other symptoms. When manic, a person becomes overly elate, more irritable, requires less sleep, makes grand plans, and may impulsively engage in potentially dangerous behavior. And the last treatment and help is psychotherapy can help people who are more stable to help them with symptom recognition and management. Medication can be used to treat acute episodes and to help prevent a relapse. Psychosocial support is an important component of treatment.
Okay, my turn is to talk about obsession, and now I will describe about obsession and the solution how to make people have obsession be better, get better, or others. Okay, today I will talk about obsession, and I will describe about obsession and the solution of obsession and ours lah. You have an obsession. Okay, celebrity, rumors, fantasy, football leaguers, and even facts are a few examples of popular obsession. Okay, for instance, if you are Yankees fanatic, you might attend each game and take off work to go to watch the game and cover your wall with Yankees poster and even send love letter to Derek Jeter. Is that the example of obsession to the people surrounding you? Okay, obsession ni is known as OCL also. Okay, OCL, which is obsessive compulsive illness, which is a type of mental illness and has two main component, namely obsessive, which is thought, and compulsive, which is action. Okay, sometimes many people are confused by the term obsessive compulsive, and many even use this term in the wrong place. Okay, for example, if some of our friends are seen as very careful and perfectionist, then continue to be labeled as OCD, which is obsessive compulsive illness. Okay, why the fact is what obsessive compulsive disorder, OCD, carries different meaning and symptoms. So what are the terms used for those who have the characteristic of a person who is very meticulous, organized, and always want perfect to do in doing something? Okay, next is what makes a person obsession or obsessed. Okay, people with feelings of love experience a rush of dopamine and other powerful brain chemicals. Okay, for some people, these feelings are so powerful that they become obsessed with keeping and controlling the person they love. Okay, next is obsession a good thing? Okay, but obsession is a powerful and potentially positive mental state. And obsession, by definition, is something that excessively preoccupies the mind. So, as a mental health professional, would I recommend that a person become obsessed? Absolutely, if that obsession is an obsession to improve. Okay, the next one is obsession a mental illness? Okay, the answer is yes. Okay, obsession compulsive disorder is a mental illness. It's made up of two parts, obsession and compulsion. So, people may experience obsession, compulsive, or both, and they cause a lot of distress. Okay, that's all about obsession.
So we make it easily. The causes of mental health is, firstly is genetics, second is childhood trauma, third is unhealthy habits, fourth is environment, the next is negative thoughts, and the last is stress. So how to take care of mental health? Firstly, unplug. Secondly, call friends. Thirdly, see a doctor. And lastly, stay active. Lastly, here are types of mental health and how to treat them. First, anxiety or depression. The treatment is talk therapy with a trained counselor or psychotherapist and exercise. Second, bipolar disorder. The treatment is psychotherapy and take medicine. Third is OCD or PTSD. The treatment is practice good sleep habits, exercise regularly, practice mindfulness, and manage stress.
Okay, and now I want to make a conclusion from the e-poster that I and my friends just present just now. Okay, we choose the mental illness, and we choose 4 topic to present in the e-poster because that 4 topic is so hot in nowadays in student. Okay, the first one is depression, and the second one is anxiety, the third one is bipolar disorder, and the last one is obsession. Okay, now I want to conclude about the first disease that my friend present just now, which is anxiety. Okay, the anxiety is a taste that is experienced by everyone and the taste become a separate alarm for our body every time. Okay, the second one is depression. Okay, what is depression? Depression is emotional disorder a person causes when feel prolonged sadness. We can call as mental illness. Okay, and now about the bipolar disorder is the one of the health problems mentally important. Okay, after that about the bipolar, this one is extreme to euphoria, become severe depression and mediated by mood periods. Okay, bipolar is the mental illness also. Okay, the last one is about obsession. Okay, obsession is about like a crazy passion, and obsession is like a passion for something. Okay, so obsession also mental illness because obsession ni the mental always want what she want, she must get that. So she's all because always obsessed can make our mental illness also. Okay, have 4 example of mental health first aid. Okay, the first one is listen, and the second one is don't judge, the third one is give support, and the last one is Okay, have 6 causes that I can conclude what causes mental illness lah. Okay, the first one is genetic, the second one is childhood trauma, the third is unhealthy habits, the fourth is environment, fifth is negative thoughts, and the last one is stress. Okay, as a conclusion, if you have some symptom or any symptom if for mental illness, so you must unplug. Okay, unplug. And the second, call friends. And the third, see doctor. And the fourth is stay active. So if you always do the thing that you like, so you cannot have mental illness.